Hi everyone, I am Dr. Karthikeyan. I am a specialist in general surgery working in Imara Healthcare in Doha, Qatar for the past 9 years. I've done my Masters in General Surgery with more than 15 years of experience after my post-graduation. Yes, today I've chosen a topic to be discussed with you people, and the topic is a very common condition that we see in our living population. And this condition has got a prevalence rate of more than 30 to 40%. That too, the prevalence of this condition is more seen in developed rather than in developing countries, and it is very common in this part of the world, in Middle East countries. And the topic is none other than the anal fissures and hemorrhoids. So why I have chosen this topic together, because even though it looks similar for most of the general population, these two conditions, they often get confused. Why? It is because they think it is the same, but it is actually not the same, even though it is being caused by the same kind of an etiology, but the condition looks little different in the presentation and in the management, but the causative factors are more or less similar. So let me start my discussion. As I told, these two anal fissures and hemorrhoids are being caused by passing very hard stools, that is having difficulty in passing your bowel movements if you have got any straining. So the causative factor starts from this. But an anal fissure, it's being defined, how it is being defined is it is a linear tear in the delicate mucous membrane that is lining the anal canal, that starts from the dentate line to the anal verge. While in case of an hemorrhoid, it is a lump or it's a dilated swelling of the veins that is being seen in the anal region or in the rectal region. Both these conditions, as I told you, has been caused by the passage of hard stools. There are different types of hemorrhoids and different types of anal fissure, which we will discuss in our topic later. But what are all the common symptoms the general population goes through? While in the case of an anal fissure, the most prominent symptom that the patient suffers is the pain. In a case of an acute anal fissure, the most common presentation is the pain which the patient goes through, and he might also have other symptoms like itching, sometimes some kinds of an anal discharge, and also in case of a chronic anal fissure, the patient might be even having a small lump which is otherwise called as a sentinel pile tag that ends up in the case of an anal fissure. But in case of an hemorrhoid, what happens here? The most common presenting symptom in a case of an hemorrhoid will be a bleeding. Mostly these hemorrhoid conditions, to start with, are generally painless. The first symptom they come across is bleeding in stools, that could be in a very small quantity or it could be in a larger quantity. Even in anal fissure, the patient will have bleeding, but it is only seen over the surface of the stools. But in case of an hemorrhoid, it is generally painless, and the quantity is also little more and bright red in color, and it is seen either in the form of streaks or dripping while passing stools. And the second most prominent symptom that is seen in the case of hemorrhoids is patient could be having again itching here, or some mucus discharge will be there, or some patients can even feel a lump in the anal verge. When this dilated veins comes outside the anal verge and sits, the patient might even go through a symptom of a lump that is being seen. And so these are the most common symptoms we come across. Before getting on to the proper discussion of the anal fissure and hemorrhoids, let us know what are the different types of anal fissure we see in clinical practice. There are two types of anal fissure. One is an acute, another one is a chronic. In a case of an acute anal fissure, mostly the patient presents only with the pain. It is because of not only the formation of the fissure and also because of the spasm, the sphincter spasm, that causes severe anal pain that puts the patient in more discomfort. And there is another type of a fissure called as chronic anal fissure. This is normally long standing. It is generally not so painful as that of an acute anal fissure, but this chronic anal fissure, the patient will be having more symptoms like discharges, and also there can be a small lump that could be seen in continuation with the fissure on the anal verge, which is called as a sentinel pile tag. Yes, these two conditions have to be treated properly. Otherwise, there are possibilities of landing in complications like first common complication that is seen in a case of fissure is a fecal impaction, or it can even lead on to an anal stenosis. Long-standing anal fissure which is not treated properly can even lead on to an anal stenosis, and in some cases this fissure can get infected, can even lead on to formation of an anal fistula, which is nothing but a fistulous connection between the anal canal and the skin in the perianal region. And let's coming on to the types of hemorrhoids. There are broadly two types of hemorrhoids. One is an internal hemorrhoid, while there's an external hemorrhoid. What do you call as an internal hemorrhoid? Internal hemorrhoid is a lump of a dilated veins that is seen inside the anal canal, while an external hemorrhoid is the one that is being formed by the thrombosed dilated veins over the anal verge, accompanied by overlying the skin. And regarding internal hemorrhoids, in turn, it can be classified into 4 gradings. That is grade 1, grade 2, grade 3 and grade 4. How do we classify these gradings? The gradings is based on the grade 1 internal hemorrhoid is, we tell it as grade 1 internal hemorrhoid when the mass or the lump of the dilated veins is seen only inside the anal canal and it is not seen outside. These patients only have generally painless bleeding. While in a grade 2, the patients can feel this lump of dilated veins outside the anal canal while straining. That means the patient having any difficulty in passing stools or having constipation. Whenever the patient strains, this mass comes and sits in the outside the anal verge, but on other times it automatically gets in. While in grade 3, not only during the straining but also during the routine daily activities, the patient can feel this lump outside the anal verge, but at this stage also it is possible to digitally, perrectally, we can even push the mass inside the anal canal. While in grade 4, what happens? The mass permanently sits outside the anal verge and it causes more pain also, and it is not possible to even digitally or manually to replace this mass inside the anal canal. So what is a test generally being used to diagnose these conditions in our clinical setup? It is a very simple test. It's a simple bedside test. That's only a perrectal digital examination. What we do is before inserting our finger into the anal rectum, we'll first have a inspection. If there is any fissure, ulcer, or we have to look, and we do a perrectal digital examination, which can be superaided by using the disposable digital proctoscopes available to visualize the inside the anal canal and rectum. Now let's start discussing about the management. The most important part of the discussion is how do we manage these cases of anal fissure and hemorrhoids. Before getting into the proper management of these conditions, we need to have a proper assessment of what to be advised to these patients in the initial stages. The first and foremost thing is about the self-care. What is a self-care we can advise in case of an anal fissure is, we need to be advising this patient to keep this anal region very dry, use only soft tissue papers while cleaning the anal area after passing stools, and also we should advise them about personal hygiene, how to take care, and also the use of sitz bath. Sitz bath is nothing but advising the patient to sit on a lukewarm water in a plastic tub, about 6 inches of depth of water. They can sit 2 to 3 times a day for 15 minutes. That gives a very good soothing effect and also helps in healing of these fissures. And similarly for an hemorrhoid, we can even advise the patient to use soft tissue paper. Same sitz bath can be equally effective in hemorrhoids also. And also they can also be advised hemorrhoid patients to use medicated wipes for cleaning. And second important part of health education that is needed in managing these patients is about the diet and the lifestyle, which we will be discussing later also. Coming on to the medical management of anal fissures. Now getting on to the medical management of anal fissure, I want to stress an important point in this discussion. 90% of the anal fissures can be managed by medically. There is no need for a surgery in anal fissure. About 90%, if it is being properly managed, conservative management and with medical management, it is possible to either cure or alleviate the pain and symptoms of the patient here. There are a lot of medicaments available. The most common thing we are using is nitroglycerin ointments. This nitroglycerin ointment has got a local vasodilator effect on the sphincter muscles, so that the sphincter muscle relaxes, thereby aiding in the healing of the anal fissures. There are also other ointments in the form of calcium channel blockers like diltiazem, which is very equally effective also. Here the usage of lidocaine gel is limited. It only helps in alleviating the pain, but it cannot cure the fissure in case of anal fissures. And also we can advocate the usage of laxatives, because a patient with anal fissure will be having very difficulty in passing stools. So the first and foremost thing is to give laxatives so that the stool gets softer and the patient can pass the stools freely, so that we give rest to the area of the fissure area and helps in the healing. And in coming on to the medical management in case of an hemorrhoids, there are a lot of anti-hemorrhoidal creams available in the market that can be used, but here, as I told, it depends on the grade. These ointments can be effective only in the initial stages, for example in the grade 1 or grade 2, but in not all grades it can be equally effective. And there are also some medications like tablets, those are available. For example, some flavonoids are available. For example, tablets like Daflon is there in the market, which can be used to treat this grade 1 and grade 2 hemorrhoids. Then let me move on to the surgical management of anal fissures. As I told you earlier, not all cases, about 90% can be managed medically. Very rarely cases do go in for surgery. But before getting into the surgical discussion of the anal fissure, there is also one minimally invasive procedure available in practice to treat anal fissures, that is injecting into the fissure. That helps in the fibrosis and healing of the fissures. And in case of very acute anal fissure, that a patient is having severe pain and that is not subsiding even with this medical management, then there is one surgical procedure called as lateral internal sphincterotomy. This involves we do have a sphincterotomy is done so that the sphincter muscle gets relaxed. If you ask me what is the success rate in this procedure, it is about 90 to 100%. It is very effective. This is done in case of acute anal fissures. And there is also another procedure called as fissurectomy, which is only used in case of chronic anal fissure, where the portion of the anal fissure is being removed along with the sentinel tag that is seen outside the anal verge. In coming on to the surgical management of the hemorrhoids, so equally there are lots of minimally invasive procedures available in treating hemorrhoids. First one is the rubber band ligation, where what we do, we put a rubber band around the base of the hemorrhoidal column, which is only used in case of grade 2 and grade 3 hemorrhoids. Once the rubber band is being ligated in the base of the hemorrhoidal column, it gets necrosed and falls in within 3 to 5 days. And there is another minimally invasive procedure like a sclerotherapy, where a sclerosant is being injected into the hemorrhoidal mass, thereby it develops fibrosis and it gets cured. And there are also other procedures like infrared coagulation. There are also procedures like Doppler guided ligation with Doppler ligation of the hemorrhoidal arteries are all available in market. And finally, coming on to the surgical management, there are broadly two types of surgeries available for this hemorrhoids. But as I told you, not all gradings of hemorrhoids require surgery. It is mostly advocated only for patients with more symptoms and with grade 3 and grade 4 internal hemorrhoids. I am here talking about internal hemorrhoids. While grade 3 and grade 4, we do surgeries. First type of procedure is the hemorrhoidectomy. Hemorrhoidectomy, there are two types. There is one is an open type is also available and a closed type is also available. And another procedure we talk is about hemorrhoidopexy. Hemorrhoidopexy little differs from the hemorrhoidectomy. Here we use a stapler hemorrhoidectomy, where an area where the hemorrhoidal tissue is there is being totally excised. What is the advantage of hemorrhoidopexy over hemorrhoidectomy? Yes, here in this case of hemorrhoidopexy, the hospital stay is very shortened and the requirement of post-operative analgesia is also very less, and the patient recovers very faster. And what happens, the patient has the bowel movements very faster after the surgery. But one thing is that this hemorrhoidopexy, we can only do it for either grade 2 or grade 3. It is not possible for grade 4, where hemorrhoidectomy is always the best one. As I told earlier, I wanted to discuss little more on the dietary and lifestyle modification. So that is why I brought it little later. Why? Because we have to give utmost importance to the diet and lifestyle modification to these patients. Health education is very, very important, as because prevention is always better than cure. So better to prevent the formation of these conditions rather than treating it after having come. So what is the diet that has been recommended for both these cases? Yeah, we should encourage the patient to take lot of vegetables in the form of green leafy vegetables, cabbage, broccoli, cucumber, green peas, pumpkin, all those things. And also we have to encourage them to take lot of fruits like apple, strawberries, pears, raspberries, and also watermelon. And also we can encourage the patient to take more of wheat, cereals like wheat, high fiber bran, corn. It's all advisable for these patients. And always encourage the patient to take at least minimum 2 to 3 liters of water daily. Even nuts and dry fruits are recommended, like almond, figs, date, apricot is also advised. And what is the lifestyle modification you want to advise to the patient here is, first and foremost is regular physical exercises. A regular physical exercise always has a direct influence on the normal bowel movements. And it is always advisable for the patients to develop a very good, to have a habit of having a proper and regular bowel habits of passing stools daily. Never strain while passing stools, never strain. And it is always advisable to pass the stools in squatting position. Why? It is because the anorectal angle in squatting position is more favorable to pass the stools freely rather than in sitting position in Western toilets. And as I told you, sitz bath is always advised regularly. Why? Because while doing a sitz bath by sitting on a lukewarm water for 2 to 3 times a day, cleans the delicate areas of the anal region by maintaining the personal hygiene in that region also. Then coming on to the food which should be avoided in these conditions are, generally avoid taking too much of cheese, too much red meat, fast food and frozen foods and spicy foods is not advisable. And also abstain from alcohol, don't take too much of coffee and tea. And regarding the lifestyle modification, never have a more of a sedentary kind of a lifestyle. Never postpone your urge to pass the stools. Whenever you start doing this kind of an habit, your bowel training also takes a hit here. And never have this habit of sitting in the toilet for long time to pass the stools, because this habit will indirectly make you strain while passing the stools. And never use a very hard tissue paper to clean the anal region. So before summarizing, I also wanted to discuss on a very important topic on myths and misconceptions that is revolving around this anal fissure and hemorrhoid. Because generally in a population or a society, lots are being said about this condition. Mostly it is not true. Okay, the first one which I have seen most commonly is that people do believe these conditions are only seen in elderly people. But it is not true. Yes, the prevalence is more in elderly people, but nowadays it is more often seen in young adults and also in middle-aged adults. And second most common thing is that these conditions are always painful. That is what the people think. But I have already clearly explained the pain is only seen in anal fissure, while in hemorrhoids it is the bleeding. So it is not that all these conditions are always painful at all these times. And there is also a misconception regarding this kind of condition that anal fissure, hemorrhoids, there is a condition also called as anal fistula. They always think all these conditions are the same, but it is as not so. I have clearly explained these as a different presentation and each has been managed in a different way. And second myth is that people always think that people who are sitting in a chair for longer time, they are working on sitting in a position for longer time, have a more tendency of developing hemorrhoids. It is actually not so. It is only this condition developing is based on our routine physical activity. People who have more obesity might develop this condition, and people taking less fiber diet are also more prone. And there is also another myth saying that people having more taking spicy foods, they are having more possibility of an hemorrhoids. It is not directly related. Again, I am saying it is directly related only to the content of the fiber food which we are taking. And there are also some other myths regarding that these conditions are being caused only by sexually transmitted infection. It is not so. And there is also a myth among the people that these conditions can be treated by herbal remedies. So they don't even consult a doctor, they start taking herbal remedies. I am not saying no. Yes, these herbal remedies have a temporary relief, but they cannot cure this condition. It is always advisable to consult a doctor if you are going through these conditions. And as I have already told earlier, people have a fear among them. When I go to a doctor, he is going to suggest me surgery. But it is not so. I have clearly explained in my topic presentation, 90% of the anal fissures can be treated medically, and only few cases of an hemorrhoids do require surgery. So never have a kind of a concept that all these cases only require surgery. That postpones a patient visiting the doctor. And last and foremost important thing is that people always feel that it is very embarrassing. They don't want to discuss this condition among either to their peer people, or they always fear they should not go have a kind of an hesitation visiting doctors. Please come out of it. It is very, very common condition seen in general public. Always never hesitate to go and consult your doctor. They would like to summarize now. It is very, very important to have a very good health education and healthy lifestyle practice in both to prevent both these conditions of anal fissure and hemorrhoids. It is very advocated. We should always follow a proper diet pattern, proper lifestyle modification. All these conditions are treatable. As I have told you, there are a lot of medical managements available to treat the anal fissure, and there are a lot of minimally invasive procedures available, and there are also surgical management which is only applicable in case of higher stages. Like higher stages only it is needed. So always follow a proper healthy lifestyle. When in doubt, don't hesitate to go and consult a doctor. And always when you have a pain, when you have a bleeding, when you have any symptom of any swelling in the anal region, please consult a surgeon so that you can be treated in the very earlier stages. If you report to the doctor early, it can be treated medically. Otherwise, you will end up in surgery. And in Qatar, if you want any consultation regarding these cases, you can very well come and meet me in Hemorrhoids Healthcare, which is situated in the Asian town in Doha, Qatar.